Welcome back to Risk It All, Nursing Theory Edition. Now that we return from commercial break, let's review how much money each team has on board. Team Abdella, you have 2,840 on the board. Team Peplau, you have 3,150 on the board. And Team Patterson, you have 2,990 on the board. Before we continue, can we ask the remaining contestants to reintroduce themselves? Team Abdella, we'll start with you.
In 1960, I created a grand nursing theory based on human needs called the Patient-Centered Approaches to Nursing. I created it mainly for nursing education in the clinical setting, and it was meant to direct nursing science towards a patient-centered focus and away from a disease and medicine approach to patient treatment. I am a strong believer that nursing is based on an art and a science that molds the attitudes, intellectual competencies, and the technical skills of the individual nurse into the desire and ability to help people, sick or well, cope with their health needs. My theory is a set of 21 nursing problems as well as 10 steps to help initially identify these problems, and 11 skills that are used to develop a treatment typology to help bring these problems towards the direction of health.
Thank you very much. It's great to have you here today. Team Peplau, can you please introduce yourself?
Hello, everyone. My theory is known as Peplau's theory of interpersonal relations. I worked in a variety of nursing fields, primarily in the mental health sector, which is where I pioneered this theory. I created this theory in 1942 based off of observations made from interactions between student nurses and patients. I believe that in order to solve nursing problems, we have to make the patient in charge of their own care. This increases self-reliance. In my theory, there are 4 phases that every nurse-patient relationship must work through in order to solve a problem. These phases are orientation, identification, exploitation, and resolution. By the end of these phases, the patient has trust for the nurse and feels supported and confident enough to address future problems.
Thank you for being here with us today, Peplau. Team Patterson, you're up next.
My theory is called the Humanistic Nursing Theory. I created it alongside my colleague Loretta Zadarad. Our theory was developed in the 50s and 60s and was first published in 1976. We created our theory because both Zadarad and I felt a calling from within ourselves to find and be able to explain the meaning and value of our own nursing practice. We began by studying the concept of ambivalence and related health terms, such as growth, health, freedom, and openness. Through this discussion and research, we decided to focus our theory on the concept of comfort. Through our theory, we developed 5 phases of the nursing process.
Thank you, Patterson. For the final question of the night, would you like to keep what you have or risk it all? If the judge feels your theory is the most helpful for the analysis, you not only win the money on board, but an extra $5,000 for a charity of your choice. Team Abdella, would you like to keep your winnings or risk it all?
Yes, I'd like to risk it all.
Team Peplau, would you like to keep your winnings or risk it all?
I'd like to risk it all.
Team Patterson, how about you? Would you like to keep your winnings or risk it all?
I'll risk it.
All right, I will read out the scenario, and you will all have 5 minutes to prepare your answers, and I will pick a team to go first. Here is your scenario. Amy is a 26-year-old female, recently diagnosed with type 2 diabetes mellitus. She is worried about how she'll be able to manage treating her diabetes at home. She worries about being able to manage her medications as well as what other people will say about her diagnosis at her young age. The doctor comes in to explain all her medications that she will have to take, her diet, the importance of exercise, and other lifestyle changes that she will encounter. She appears to be overwhelmed by all the information the doctor is telling her. The moment the doctor leaves, she turns to you and asks for help, understanding how she will be able to possibly manage treating her diabetes without affecting her social life or studies. Okay, your 5 minutes begins now. Welcome back to Risk It All, Nursing Theory Edition. Each contestant has decided to risk it all and approach the scenario. We're going to start with Abdella.
Using my 10 steps to identify the client's problems, I am able to highlight which of the 21 nursing problems are most applicable to Amy's case. I am able to determine that Amy has many overt as well as covert issues that require assistance and treatment to move towards the direction of optimal health. Of the 21 problems, the problems that are most pressing with Amy's case are problems 1, 2, 6, 9, 10, 18, 19, 20, and 21. Problems 18 and 19 are considered to be some of the most difficult problems faced by patients as they fall into the category of socio-physiological needs, which are more so covert in nature and difficult to identify. I would then use the 11 skills to develop a treatment typology for each of these problems in order to best meet patient health needs as the individual patient. I believe that my method is effective to optimally care for Amy in dealing with her recent diagnosis, as it reminds us as nurses to look beyond what just the issues that the patient is dealing with that are right in front of us and seek covert and less obvious problems that, when resolved, can also resolve overt problems. It also provides a sort of checklist which allows us to assess the total needs of the patient for planning care, as well as setting priorities and ensuring that patients are on the path to regain health.
Thank you, Abdella. That's an interesting way to approach the situation. Next, I would like to give the table to Peplau.
My theory focuses on helping the client meet their goals by providing care that is tender, attentive, compassionate, and concerned, while also advocating for the patient and performing various hands-on practices to enhance the comfort and well-being of the patient. My theory assists nurses in helping patients make sense of and learn from their responses to experiences related to health and illness. The goal is to have the patient be self-sufficient at the end of the relationship. At the beginning of the relationship, the nurse and Amy are in the orientation phase. During this phase, the nurse performs two functions. Firstly, the nurse provides resources to help Amy understand what she needs to know and what the problem is. And next, the nurse will encourage Amy to talk about her feelings and concerns. In this stage, the nurse will understand that Amy needs help managing her diabetes, so she may provide her with written resources that help her plan her care. The next phase is the phase of identification. This phase can begin when Amy has identified what she's hoping to learn and gain from interacting with the nurse. In this case, Amy is hoping to learn how she can manage her diabetes at home. Amy will also identify people that she can trust with managing with her diabetes, including nurses, doctors, family members, and/or friends. Amy may wish to lay out what she needs to do in a day or week in order to care for herself, and she may identify her mom, family, doctor, and her best friend as helpful members alongside the nurse. The following phase is of exploitation. During this phase, Amy is comfortable enough to fulfill what is needed of her to manage her diabetes, and she feels that it will not cause too much of a disturbance in her life. In the next phase, the phase of resolution, Amy is comfortable being able to care for her diabetes and has addressed new goals with the nurse. As her goals have been met, she is more secure in handling her own problems, and this leads to increased confidence. My theory aims to shift the power from the nurse to the patient, which leads to increased confidence of the patient, and eventually they are more capable of solving their own problems.
Thank you for that, Peplau. Patterson, you're next.
Our theory mainly focuses on the idea of humanism. So as the nurse in this situation, it is important to look at the individual, so Amy, and take a broad perspective of her potential and try to understand her from the context of her own personal experiences. So to help Amy reach her full potential, we can use our 5 phases of the nursing process. So phase number 1, preparation of the nurse knower for coming to know. So in order for the nurse to begin to get to know Amy, she must investigate her current life and history. Number 2, nurse knowing the other intuitively. Here, the nurse tries to understand the patient. The nurse needs to understand that Amy is unique and she has her own angular view. So this means that she sees, hears, tastes, and experiences the world differently than anyone else. To begin to know Amy intuitively and understand how she thinks, the nurse really needs to understand this angular view that Amy has. The nurse should also understand the here and now of Amy. This refers to a connectedness among one's past, current, time, and future. It is inclusive of the patient's origin, history, hopes, fears, and alternatives. Step number 3 is the nurse knowing the other scientifically. So in order for the nurse to know Amy scientifically, she needs to look in at Amy and her type 2 diabetes from the outside. She needs to look at Amy's health history, family history, and any other pertinent scientific data. And then step number 4, the nurse complementarily synthesizes known others. So once the nurse has a good understanding of Amy as a person and her type 2 diabetes, the nurse can now be used as a source of knowledge. This is when the education phase of the nursing process can begin. And then step number 5 is succession within the nurse from many to the paradoxical one. The nurse takes the information learned and applies it to the practical setting. So the nurse can help Amy work towards well-being and then towards more being. More being refers to a person becoming even more, and it is a chosen way of being. She can also help Amy achieve comfort even with this diagnosis. Comfort conveys the notion that a human being is all they could be in accordance with their potential at any particular time and in any particular situation. The nurse can help Amy achieve comfort by being present and providing her with support.
Now, we will leave it up to the judge to see who will be going home with their winnings, as well as the $5,000 charity donation. Judge, let's hear it.
Peplau, some strengths of your theory is that it's broad and applicable to the scenario. It has simple, easy steps to follow, and also it focuses on the nurse-patient relationship, which is really good. However, it may only be applicable to those who want to make a change, and in this case, Amy might not want to make that change. It doesn't prescribe the actions that need to occur in between the stages in order to move to the next stage, and also the patient must trust the nurse in the scenario, and we don't know if that will happen. Abdullah, your theory has extensive research behind it, which is excellent because we know it's going to be applicable to the scenario. Also, Abdullah, your theory helps identify less obvious problems so that you can resolve the more covert problems, which is good because Amy has a lot of needs that need to be met. A limitation, however, is that it's only made for nursing education, so we don't know what's applicable to this scenario, and having a list of specific patient problems can lead to breaking down the patient clinically rather than seeing them as a whole, which is what we would like. Patterson, your theory really promotes patient-centered care and the caring relationship between the nurse and the patient. However, some limitations may be that due to time constraints, you won't be able to apply the theory in full. It uses abstract concepts and terms which makes it hard to apply and understand. Okay, Peplo, I've decided that your theory of interpersonal relations has won the contest.
Congratulations, Team Peplau, and thank you to our viewers. We will see you next Tuesday at 7 p.m. for Nursing Theories 2.0, starring Oram, Watson, and Leninger. Good night.